Fetal anomalies. Fetal anomalies, often referred to as birth defects, are structural changes to one or more parts of the fetus body that increases the chance of stillbirth and can cause deficiencies in the child's health, development, and quality of life. Fetal anomalies refer to unusual or unexpected conditions in a fetus development during pregnancy. Causes of anomalies. There are different causes. The main causes are the genetic problems, chromosomal problems, infections, exposure to medications, chemicals, or other agents during pregnancy. Although congenital anomalies may be the result of one or more genetic, infectious, nutritional, or environmental factors, it is often difficult to identify the exact causes. The birth defects can be caused by genetic factors and by a variety of environmental injuries such as infection, radiation, and drug exposure during pregnancy. The majority of birth defects, however, are without detectable cause. About 20% of birth defects are caused by genetic or hereditary factors. The most common severe congenital anomalies are heart defects, neural tube defects, and Down syndrome. Anomaly scan. Ultrasound is the most common tool used to detect birth defects. This detailed ultrasound scan, called anomaly scan, sometimes called the mid-pregnancy or anomaly scan, is usually carried out when you are between 18 to 21st week pregnant. You are means the patient. The 20-week scan is offered to every patient. It is in most of the advanced countries, it is covered by their insurance. This anomaly scan usually takes about 20 to 30 minutes. However, the sonographer may not be able to get good views of the fetus lying in an awkward position or is moving around a lot. Then it can go up to 40 minutes. Fetal head anomalies. This is how we take the fetal head measurements. This is for BPD. And I hope most of you know that this is the falx cerebri, the thermi, the cavum septum pellucidum, the parietal bones. So biparietal means between the two parietal bones. We usually use headlock method for measurement of BPD. And for headlock measurement protocols, we need to take one outer and one inner for the measurement. One is the outer side of the parietal bone, the other parietal bone we will take the inner side. It depends which one is more clearer to you. You can take the outer of this one and inner of this one if it is clear. The first anomaly is anencephaly. It is the single most common neural tube defect. It results from failure of neural tube to close at the cranial end of 38th menstrual days. 38 from the last menses. As a result of cerebral hemispheres, the calvarium of the skull do not develop. Skull and cerebral hemispheres are not formed. In anencephaly, the fetus is born without parts of the brain and skull. As the neural tube forms and closes, it helps form the fetus brain and skull, upper part of the neural tube, spinal cord and backbones, lower part of the neural tube.